and the benefits of doing training, PT, kind of like prehab type of things prior to, giving birth. So a lot of times people will have this misconception of, why do I need to start physical therapy if I'm going to have a baby anyways and things are going to change again? Is there really any benefit to it? And the truth of the matter is that there actually is quite a bit of benefit towards doing physical therapy prior to giving birth. So the way that I like to think about it is thinking about PT and during pregnancy as kind of like prehab. So if you were to go get a knee surgery, right? Let's say you tore your ACL. One of the things that a doctor is going to likely do is say, hey, why don't you do some PT prior to your surgery so that you have better outcomes afterwards? So what that really is doing is that's, helping you really gain strength and stability so that you have less of a, kind of a climb back to your baseline after that surgery, because you're gonna have to have strict protocols of how much weight you can put on that knee or that leg, how much you can bend it. And so that's obviously gonna take away from your strength and mobility. And so they wanna make sure that you have a better outcome on the other side. Same thing goes with pregnancy. We want to make sure that you're strong and mobile, not just for labor and delivery, but for afterwards on the other side, because, once you have the baby, you're going to have even less time. So it's better if you kind of get a jump start and do a lot of these things prior to having a baby, and something else to kind of fill up your time and your schedule. So we're going to go over about like 5 different, reasons why you should do physical therapy or training prior to. So the number one reason you want to take advantage of doing things during your pregnancy is pain relief. So 90% of women will experience some type of pain during pregnancy, with the number one reasons being low back pain and pelvic girdle pain. So back pain is one of those that probably the majority of women will experience. And research suggests anywhere between 50 to 70% of women will experience back pain during their pregnancy, with about a third of those reporting that it's severe enough that it interferes with their ADLs or their activities of daily living. This can mean just day-to-day house chores. This can mean traveling to work. This can mean actually your work. It can also mean taking care of other kids or other family members if others are dependent upon you. So that can be pretty severe. The other big one is pelvic girdle pain. This can be pubic symphysis dysfunction, or that pain right in front of the middle of the pubic bone. It can also mean like SI joint dysfunctions or just generalized pelvic pain. So a lot of the times when it comes to pelvic girdle pain, it really does affect mobility in general. It can mean decreased tolerance for standing. It can mean decreased tolerance for walking and moving around, even lying down. I myself experienced pubic symphysis dysfunction, and I actually felt better up and moving. But as my pregnancy progressed, I wanted to rest a little bit more. I was getting tired. But unfortunately for me, resting also meant dealing with a little bit of that pain. So a lot of times that can be a big contributing factor. Other pain symptoms that you can experience are things like round ligament pain, carpal tunnel syndrome, leg cramps, headaches, hip and sciatica type pains. And there's lots of different reasons for why we experience pain during pregnancy, but one of the biggest ones is likely hormonal changes. Hormones are going to affect the ligaments. So relaxed ligaments are going to mean decreased stability. If you don't have that stability prior to even getting pregnant and that strength, then it's just going to it's a cascade effect. Once it gets going, it's just harder to kind of get back on it. But definitely doing some type of PT, doing the right type of physical activity will definitely help to decrease this. The other reason is increased weight. So increased weight from the baby, from increased breast tissue, all of this is going to add increased added stress to our joints. So if you think about our belly kind of just pulling us forward, it really does bring us into that anterior pelvic tilt. Breast tissue will help make us a little bit more rounded forward. So those are the kind of things that we're looking at when it comes to weight. There's also a shift in the center of gravity. Again, that belly, as we get further into that third trimester, is really going to change our posture, which is again is going to add more stress to our joints. And then also, if you have any pre-existing conditions, if you already came into the pregnancy with like a sciatica from before or disc issues, that's also going to maybe be a little bit more exacerbated when you're pregnant. So with most of these things, when it comes to pregnancy, you're experiencing it probably at its worst as you get further into it, likely into that third trimester. Certainly, if you're experiencing it sooner, that doesn't mean it's going to go away with time. It's likely going to get worse. Again, from the things that we mentioned, like the posture and the weight gain and just the hormones. So it's really good to get ahead of it with the exercises. So in addition to PT, some of the things that you can do to help manage pain are things like massage. You can try doing supportive garments. A lot of times for my pelvic pain patients, I'll often suggest using like a compression garment. I really like Valbe and their things that they offer. I used it particularly in my last 2 pregnancies. Basically was a more comfortable belly band. Typically with the ones that I had for my first 2 pregnancies were very bulky and a lot of Velcro, and I didn't like it, especially when it was a summer baby. It just felt like more things to add on. But the things that from Valbe were nice because they were a little bit more snug and supportive, almost like a sports bra versus like adding on extra straps and things to worry about. The other thing that you can do during pregnancy is things like low impact, gentle exercises like walking and swimming. Swimming is a really great option if you have access to a pool, specifically because if you get into the deep end, then you're starting to unweight yourself. So if you're dealing with a lot of like pain because of added weight, this can be a great option. Also, it will help to just cardiovascularly. Even if you're not swimming, you could just do walking laps up and down, which is what I did with my second pregnancy a lot, and I really enjoyed that because it was winter and I was not about to go outside walking. So swimming in an indoor pool, regulated temperature was awesome for me. Reason number 2 for doing PT and strengthening during pregnancy is because it'll help your core and pelvic floor. So it'll strengthen and coordinate the muscles that support your baby, your bladder, and your spine. And it also helps to reduce things like leaking and prolapse, or even severe postpartum weakness. So research suggests that 29 to 41% of women experience stress urinary incontinence during pregnancy, with symptoms worsening with advanced gestational age. So again, the further along we get into our pregnancy, the more severe that things will get as far as like pelvic floor symptoms, especially the stress incontinence or that leaking urine is what it is. Some things that contribute towards this are mechanical stress. So we're talking about increased pressure and stress from the growing uterus, from the growing baby, and this will put more pressure. As if you've ever been pregnant or if you're pregnant right now, you may have noticed that the further along that we get, the more trips we're taking to the bathroom, and it's exactly for this reason. The other reason is hormonal changes. So increased progesterone and relaxin will weaken the pelvic floor muscles and those ligaments. So making sure that we do those exercises to support this will help to counteract that. Obesity, so if you have a high BMI before or even during pregnancy, it will make that stress incontinence worse. And again, it's more of that mechanical stress coming from an outside factor from the pregnancy. So it's more of personal weight gain versus the baby and the uterus growing. Also, if you were already dealing with incontinence prior to getting pregnant, then those symptoms are likely going to be worse as you progress, or even on the other side in that postpartum phase. It's not totally uncommon for women to experience some type of stress urinary incontinence, even like when they're in high school. A lot of players who do high impact sports like volleyball or basketball, where they're jumping a lot, girls can have that stress urinary incontinence. So if that was already there prior to pregnancy, it'll likely be worse. Also, parity. So some studies suggest that the number of pregnancies will increase the chance of stress urinary incontinence. I personally believe this is also due to advancing age. So as we get older, our tissue is less supple. We're weaker. It takes longer for us to gain that strength and keep that strength. So the closer you are to like your 40s or that what do they call it, geriatric pregnancies, then I think there's more chances of the stress urinary incontinence being a little worse, just because we have muscles that are weaker unless we've been training them consistently throughout our early 20s and into our 30s. Reason number 3 to do PT prior to is improve labor and delivery outcomes. This can help with breathing, relaxation, pelvic mobility techniques, which can help with the smoother delivery and labor. One of the things that I like to do with my patients is we will do what I call like a push prep session. So whether or not you're going to do a C-section, or if you're trying to do an unmedicated labor, vaginal delivery, or if you opt to have a epidural, this will all help with that. So basically we go over things like anatomy. Once we know a little bit more about our own anatomy, we have a better understanding of kind of what to do. So we go over the anatomy, we go over different labor positions. We go over pushing positions, we go over scenarios, like what if you do end up with a cesarean and you were planning for a vaginal delivery? What can you do, especially in those early stages of, recovery, those first couple of weeks before you even get seen by a PT or OBGYN, midwife, whoever. There are certainly things that you can do on your own to kind of help speed up the healing process. What do you do if you aren't able to get the epidural that you were waiting for? So kind of working on pain management techniques. What are some things that you can do there? And then also, like, what if you end up having to get an epidural? Now, all of a sudden, all your labor moves. What are you left with, right? Because you're going to be bedbound at that point, or likely bedbound. So we kind of go over those different scenarios. We also go over, I mentioned this before, just kind of pain management techniques that you can do at home during labor. As you progress at the hospital, what are some tools that you can use that are readily available for you there, whether that is using like the peanut ball or like a bench or stool or even the side of the bed. What are some things that you can do? If you're wanting to get your partner or spouse involved, how can they help you during labor? I am a really big advocate for getting partners on board, simply because when you're going through labor, especially if it's something where it's unmedicated or something, unplanned, they kind of can be your advocate and they can really help you kind of guide you through the things that you've been practicing. So if you can practice together even before the big day, that'll be even more beneficial. For me personally, I told my husband that I didn't want to do the epidural after the first one. So the last week I told him, when I was like about 38 weeks pregnant, I said, hey, I'm telling you now with a sound mind that if you could, help me to stay on board of not getting the epidural, because I knew I was going to cave in. So that's exactly what I did. And sure enough, when I was about 8 centimeters dilated, I was really wanting it. And the nurse came up to me and said, okay, this is kind of your last chance. Do you want the epidural? And I remember looking over at him, and he just looked at the nurse and he was like, she said no. So, that really helped a lot to kind of help me on my game plan, because I'm sure after everything was said and done, I would have been like, man, I should have just stuck out with it. Why didn't you tell her no? So I'm glad that that really helped. Um, in addition to that, dealing with my own pain management, he was able to help me and give suggestions of things that I may have forgotten. Like, hey, do you want to try putting your leg up on this stool while you rock? Or do you want me to do some pelvic compressions for you at the next contraction? Do you want to get into the shower and get the warm water running on your back? So all those different suggestions would help because, when you're in it, in the moment, sometimes we forget these things, even as someone who teaches this all the time. So it's nice to have somebody else on board with you there. And the other thing, as far as kind of PT helping out prior to, is we can help you decrease the chance of tearing with just different techniques, different breathing techniques that we go over. And also we can help to decrease the chances of like labor stalling. I know that during pregnancies, I get often reported from my own patients that, they ended up getting the epidural and then that their labor just kind of stalled after that. So what can you do even if you do have the epidural to kind of reduce the chance of the labor stalling and then, kind of end up having to have a C-section if that wasn't part of your plan. So definitely PT can really help with education there. The fourth reason that we want to do PT during pregnancy is because it will help with improved posture and movement mechanics. So guidance on lifting, sleeping, and daily activities will help protect your joints, and it'll help to decrease strain on these joints. Especially if you already have toddlers where they're still really depending on you and you're having to repeatedly lift little ones, into their car seats, into their cribs and things like that. Being able to do it correctly will help to reduce that pain, especially in your lower back or in your pelvis if that's something you're dealing with. Sleeping is a big one, especially the further along that we get, especially if we're already dealing with pelvic pain. Kind of as I mentioned before, when I would go to rest, that's when I would get more pain. So really knowing how to set up your pillows and what positions you can to sleep in other than just on your side. Because obviously from your belly is off limits, and then even lying on your back is limited. So knowing what else you can do other than laying on your side, or how to lay on your side correctly, will help a lot. So one of the things I really like to mention during sleeping positions is being able to use your pillows correctly. And then even the way that you lay with your legs, either they're going to be both straight or they're going to be one bent and one straight, just to help reduce that stress on the pelvis. It'll help to prepare your body for physical demands of motherhood. So if we help train you in advance, if you think about it, like what's going to look like afterwards when you have your baby, you're going to be doing a lot of like holding the newborn, right? So that's more rounding of the back. If you're breastfeeding or even bottle feeding, you're still in this position. Again, that's rounding of the back. If you're rocking your baby to sleep, that's rounding your back. If you're washing bottles and doing laundry, that's again rounding your back. So we like to get ahead of things and really train your upper back muscles in addition to everything else. And I think that's one of those places that people don't always think about. They think about their pelvic floor, they think about their core or even the lower back, but a lot of times it's missed is their upper back. And if you can get a good, strong upper back, that's going to help everything down. Because if you think about it, our bodies are just one big chain. So if you fix one end, it'll help to kind of help the other side as well. It'll also help prepare yourself for the rapid weight gain that we have of the little ones. Once they're out, they might be 7-8 pounds initially, but they gain weight quickly. And it's a lot harder for us to kind of keep up with them. So if we prepare ourselves in advance, we'll have a better chance of being able to take care of them without necessarily dealing with those aches and pains afterwards. The other thing is that when you're in that postpartum phase, you have even less time to, dedicate to yourself, especially if it's your first one. And it might seem odd, but just speaking from my own personal experience, when you have one, all your time and attention is focused on that one. But later on, once you have 3, 4, and then beyond, it just somehow gets easier. Even though there's more chaos and there's more kids to take care of, I think you kind of see that, or you realize how important that you time is, that me time. Even if it's a good 20, 30 minutes, you're going to make the most of those 20, 30 minutes that you give yourself. Versus like if you have that one, everything's focused on the baby, and then I don't know where our time goes during that time. And then the final reason to do kind of PT prior to is faster postpartum recovery. So moms who address issues early often will heal quicker after delivery. This can mean diastasis is improving quicker, pelvic floor is improving quicker. If you're dealing with any type of tearing, it will definitely help. Knowing what to do during pregnancy will help to speed up that recovery afterwards. You will learn what to do if you have a cesarean. What can you do during those early few phases before you see a PT or prior to being seen by your OBGYN? There's definitely lots of things that you can do during those first couple of weeks to help, aid that healing. And a lot of times it does come down to breathing and posture, and it's all those things that we work on during that pregnancy phase. And then also it will just kind of give you a head start overall for getting back to the things that you like to do, whether it be back to running or just strength training. You have, again, thinking back to that ACL analogy, is that you have a better outcome on the other end just because you've already been strengthening and putting in the work prior to. So I know that's, kind of a gist of the benefits of PT during pregnancy. There's definitely a lot more that we can do, and it's all kind of like case by case. But if you have specific questions or any other questions regarding physical therapy, what all we can do, if you're having certain aches and pains, all I can say is don't wait. Ask a question, either myself or another, pelvic floor specialist on how it is that we can help, because chances are we are going to be able to alleviate you of those aches and pains. I'm here. You can go ahead and send me a message if you have those questions, and we love to work with you if that's something that we are able to do. All right. If you are joining us as part of our BluntFit University community, I'd love to hear if you learned something new, if you've done PT before in the past, or if that's something that you're looking to do during your next pregnancy or in your current pregnancy. And one final little tidbit before heading out is you don't have to have pain in order to do PT during your pregnancy. I have seen several women just wanting to be proactive about things. Maybe they knew that their mom had prolapse during their pregnancy or afterwards, and they're trying to be proactive about it and getting stronger so that they have those outcomes afterwards on the other side. Or maybe they're wanting to keep training during their pregnancy and they don't know how. That's something else that we can also help out with, is keeping you safely training through each trimester. Things do change, so kind of modifying and adjusting different exercises that are safe for you, that can still work on not just your legs and your arms, but also your core and definitely your pelvic floor. And again, getting you prepped and ready for labor and delivery. All right, folks, I hope that you guys learned a ton, and I will see you again next week for another live action. Thank you so much.